Hi, this is Mrs. Terry, and I am going to try something different this semester, and I'm going to try to record your chapters, see if that helps you with some of the learning that you need to have done. So we're going to start with Chapter 1. This is for Unit 1. So if you'll turn over in your book, also make sure that you read your PowerPoints, know your PowerPoints, read them more than once, read your chapters more than once, always learn the key terms that are in the front of your book. And additionally, in your book, there are memory joggers that you'll see along the sides. There are little boxes called Did You Know boxes, drug alert boxes. Make sure you read those, study those. They're there for a reason, and actually I find them very, very helpful. And towards the end of your chapters, you will have key points that I find usually are a good wrap-up so that you embed some of this information in your brain. There's also some review questions, some critical thinking questions, but those key points I usually find are very interesting. So we just look at the overview of drug therapy and what a drug is, what is a medication, and in this section, a drug and a medication are the same terms. Any drug can be misused or harm a person. We need to make sure our patients understand what their medicines are and what they're taking and how they can be helpful and how they can be harmful. We have intrinsic drugs and extrinsic drugs. And intrinsic drugs are those drugs that we make within our own body, such as insulin. Extrinsic drugs are the drugs that we give a patient. Drugs are given so that they have an improved body function. They have an intended action and a therapeutic response. Physicians have a plan for why they're going to give a patient a medication. In addition, we need to know drug names, and in drug names there are generic names and trade names. The generic name is a shorter, simpler name used by pharmacists and to help identify that drug. A brand name or a trade name are created by the drug company that makes and sells a specific drug. So a brand name is called a trade name or a proprietary name. That's the name that the drug company uses to sell that medication. So Tylenol, Advil, that sort of thing are brand names. You also have over-the-counter drugs. You know those are important for your patients to tell you what they're taking that is over-the-counter, especially vitamins and herbal supplements. As far as drug regulations go, the USP, United States Pharmacopoeia, they're the national group that develops the standards for drug manufacturing, safety, packaging, that sort of thing. The FDA, is the U.S. government agency that enforces the standards set by the USP. So the USP sets the standards for all pharmaceuticals, and the FDA enforces those standards. The DEA, which is what I said incorrectly a minute ago, of course, that's the Drug Enforcement Agency. So how do drugs work? You'll see that on page 6 and 7. We won't go through a lot of that, but those are all about the receptor sites on the cells and how drugs are manufactured to attach to certain receptor cells, receptor agonist and antagonist. And I won't spend time going over that right now. Physiological effects, there are side effects and there are adverse effects. Side effects is usually listed in the handout for the medication. Many times it's nausea, headache, dizziness, different things like that that are not necessarily going to be harmful to the patient, but patients should expect that they may have some of these side effects. However, an adverse effect could be a very harmful side effect. It could be deadly, as a matter of fact. So many times you need to really watch for adverse effects. There's a picture of Stevens-Johnson syndrome in the book, and especially one that is on our PowerPoint is angioedema, swelling around the mouth. That is very life-threatening. If a patient starts complaining of tingling, numbness around their mouth, you need to really pay attention to that patient if they've taken something new, because they could be having a very serious effect. That swelling can swell their airway, and you would have an emergency on your hand. Allergic responses is a type of adverse effect, and those could be mild or not, but anaphylaxis certainly is an inflammatory response. People get tightness in the chest, hives, wheezing, that sort of thing. Very, very serious. We talk about minimum effective concentration on page 10, the MEC. When we hear that term, we're talking about loading dose and how much medication has been given to the patient. And so drugs have a half-life and or a life, and we learn about their half-life so we know how fast they will be metabolized through the body. So the physician often gives what we call a loading dose, and the loading dose is a larger dose. You see sometimes when you start antibiotics you take 2 at the beginning. That's why, because he's loading you up with that medication, because he wants enough of that medicine in your body to give it an effect to start out. And we talk about the bioavailability. Once that medication is in your body, the bioavailability is how much of that medication is available to help the patient that has not already been metabolized out of the body. So the bioavailability is an important term. MEC, minimum effective concentration, is an important term. And then you'll hear physicians order peak and troughs. Those are 2 labs that once certain medications are given, he'll order a peak to see what the peak dose is, and then a trough later on. Drugs can enter the body percutaneously, through the skin, enterally, through the GI tract, and parenterally, which is anything involving a needle. You need to know that. On page 12 are the advantages and disadvantages of the drug route. So you would think an advantage and a disadvantage, but an advantage, of course, to IV is that's the fastest route. The disadvantage would be you better make sure you're giving the right med, the right dose, etc., because you're putting it right into their bloodstream. The enteral route is the movement of drugs from the outside of the body to the inside through the GI tract. It is the most commonly used route of drug administration. And then, of course, the parenteral is anything involving an injection. It is quicker and more completely absorbed than the other routes. Oral, the enteral, have the least predictable absorption. The distribution of the drugs is how the bloodstream takes those bloods and distributes them through the system, and those can be through the plasma, which is the blood, the interstitial cells, and the intracellular cells. Metabolism, of course, is how fast that drug is used in the body, and the cells that are involved, the organs and cells most involved in drug metabolism are the liver, the kidneys, and the lungs. And you would know then that someone who has a poor liver function, poor kidney function, they're not going to metabolize that medication as fast as they should. Of course, with children, you want to think about children. You need to study the tables on page 18 and 19, and that's pretty much it for chapter 1. Thank you.